All right. So disc herniation. Disc herniation you can have throughout the spine. You could have it in the cervical, thoracic, lumbar disc herniation. Those cervical, thoracic, lumbar only tells you what segment it's in, but the herniation is all the same. What you're going to do is you can have a bulge of the disc. The disc, mainly a healthy disc, is encapsulated and stayed in. When you have a herniation of anything, you have a bulge that's in there. Okay, it's a weak spot. So it can go ahead and put pressure actually on the spinal nerve. The spinal nerve leaves the spinal cord. When you have a herniation, this inner stuff is called nucleus pulposus. That's what it's known as, but it's got the consistency of toothpaste. And what happens is these annular fibers somewhere if it's inner pressure, weight, twisting, those kind of injuries, it can weaken the annulus. And what happens is now it weakens it to the point where the nucleus pulposus sticks out. And it can stick out and hit the nerve. Then what you're going to do is have different issues of usually pretty good amount of pain to severe pain, maybe motor weakness, depending upon where it is, arms, legs, anything like that. Uh, as far as the symptoms, it's going to be definitely you're going to be feeling sensation. Pain can be one. If it's in the lumbar, you can get just like lightning bolts and jolts, and just by standing, moving, carrying things, even just by your own body weight. Treatments, what chiropractors actually do is we help adjust these joints. And by doing that, that helps bringing movement. Movement brings uh, through the disc. That's how nutrients get in, waste gets out, so the disc can actually heal. The disc is a living thing. So by doing adjustments and different PT and muscle work, soft tissue work, we can bring the patient into actually a better place pretty quickly. Normally, I'd say without non-surgical intervention, we can get them in. I've seen it from a week to 2 months. It depends on the patient, depends on the severity. I've also had patients. You got to watch out too, because if they get better too quickly, what happens is I had a number of patients. Like one was an athlete, and he felt good within I think like the first 7 treatments. So he decided to go out and play some softball. He said he didn't make it 2 plays. He came back worse than he was before. What gave me hope though was that he got pretty good pretty quick. So that knows we are on the right path. He just needs to stay through the danger zone, which is when a patient has something like this and they get better quickly, then since they don't have that pain to remind them to be careful, they lose that. And what happens is they can revert. I've done it. They've done it. It's not a big deal. We'll get you back. But that's pretty much the herniation.